there's a cassette.
Huh?
You wanted to ask. There's a cassette.
There's a one over there for lassis. On the lassi, that plastic thing on
Oh.
the yeah.
Thank you.
Thank you.
So this is where he rests his. So there will be 3 letters. One will be with him. It's always in the fridge. The other one goes with his the container for the cassette, and the other one goes to the nearest EMS. So that if he calls 911, they exactly know where he is, where the address is, just and they recognize him. And this is the medication that we have to look at.
You want to go back tomorrow? No, you're not. You're okay. You're in the middle.
Let's put your sharps on the side here.
I'll take it out. This one and put it there.
Yeah.
Put it in.
Yeah, you do this, that's all.
So
Here, I'll open this one. Right?
yes, then you wipe it first.
I
right?
wipe it. Yeah.
Alright. Okay.
You're not gonna fall, babe. I wouldn't let
No, don't drop that one
Okay.
because that is sterile, and you don't
You're
touch
okay.
the end of the tube.
This I can throw it.
Now I'm going to take this
Very good.
over here like this.
You told me you're gonna have a little sleep.
I'm gonna put this like this.
You told me you were gonna close your eyes and sleep.
This like this. I'm gonna put this.
So the package, the top there, is sterile,
It's not too warm today.
but because they're always
Yeah, it's raining.
doing the connections and swabbing it,
That's
it's
why I got
nice for them to have that simple method of just anything that is connections, they wipe.
Right.
So it becomes consistent
Mm-hmm.
and they don't forget. Very good. Very good. And
You
your
don't
sterile area.
have to take that white thing off first. I'm just asking.
I clean this area, right? And then I take this out.
Yes.
I get another needle.
You
Right?
get another needle, yeah. Same syringe, another needle. Now, if you accidentally touch the end of the needle, or you touch the inside portion of your pistol, you have to change your syringe. They have enough supplies that if they contaminate it, they just drop it on the floor and then get a new supply.
So I'm gonna clap.
Mm-hmm.
Then I'm going to take this away.
Mm-hmm.
And I'm going to throw this here.
Mm-hmm.
And I'm gonna hold this here.
He has actually good techniques. He's just slow but sure.
Numbers.
Always remember that you don't touch this portion, okay? Because otherwise you're gonna contaminate.
Right.
So what is the thing here is so this one here should be turned the other way.
Okay.
This way. This way.
You okay?
No, in between there.
No.
Okay? So that while you're taking that one out, you don't contaminate the end.
It's 5, right? Here I take 5.
That's fine, yeah.
And I put it in here. This one.
So he can't rest that down, the cartridge connector, he can't rest it down while he takes the needle off.
They can. That's true. Yeah, yeah. But that's the technique he has been using. I don't
Yeah.
want to make him confused. Yeah. Sometimes there's ways that he has his own way, and
Yeah.
they said as long as it's
Yeah, sterile.
it's sterile, it's fine with me here. Sometimes he rests it here, just like what your mom is resting it. Yeah, but he allows it as his own way, and as long as I said it's sterile, it's fine with me.
I don't think I have enough.
No, you have enough.
Okay.
Yeah.
Must
You
be.
have 5 minutes.
So what happened? You see, you're not supposed to touch this.
Oh.
So what happened with that one is you forgot to push it all the way back. Yeah. So there's two things that you can do. You can do this as well. Okay? Make it this way.
That's too far back as you go.
Be careful here all. Okay? And then do this.
How's that? Okay.
Get the liquid out. Have a clap. I'm gonna take it out.
So before you take it out, what happened? Which one are you gonna open first?
The red one.
The red one. Yeah. Open your clamp
Oh.
first. Yeah.
Have to wait till until the 5.
Until you find it, get rid of the air.
Yeah,
Do you have any air there?
I think so.
Where?
Here.
There.
Yeah.
So you have to
That
tap
was
it.
a mistake.
What was the mistake?
I should use the other end. So this small side,
Uh-huh.
I should,
Yeah, that's the right one.
but I was almost about to do the other side.
Because that's where he has to pick up the red cap.
Clamp is done. Hold this.
Careful that you don't touch the end, okay? Yeah. Can I ask you something? Can I do something about you? Can you put this on the side so that this one is closer?
Oh,
Yeah.
yeah.
Okay. That way you don't go over.
Just close.
Good.
Now I'm going to clamp and put the red cap on.
This one, I think
Yeah.
the AI is gone. Eh?
Yeah. And then you have 5 from your
5. Yeah. Not
not quite. Yeah. Pull back.
full back.
Yeah. Make it 5. So you remember the big white line there?
You get to use the same
You
syringe.
see it?
Yeah.
That's the way it should be. Yeah.
And turn it down.
Turn it down.
Now I'm
Touch
going
here,
to
touch
open
here.
this.
Remember how to cover the needle?
Yeah. Oh, with
yes.
the
That's right.
put it in.
Not yet. What happened to your
Oh.
Caripul? It will remind you because you will have to inject that
Three.
Caripul is still
Sterile
there.
water
Yeah.
Yeah.
Just stir out one.
Clean that again.
Do I have to put a rubber
So
band
what
on
we
there?
made some compromise is if he hasn't touched the top, he doesn't have to.
Okay.
Right? Yeah. Because as they go and mix their medication, it's going to be fast.
Faster.
Yeah. Yeah, no, don't touch this.
Okay.
Always
Oh,
that.
yeah.
Okay.
Okay, so now that I have this red cap.
Mhm.
Can I move this
Oh,
away?
yeah, yeah.
Push it to the corner of the table so it's not in the way.
Stronger. Okay. I can take this here, right? So I can put this here. And then take this.
So normally what he does is he usually have a bigger space for her sterile too. So I will give you that extra.
I still think it shouldn't have put it over there.
That's okay. That's alright. Yeah, it's okay. You learn it. That's alright. Don't. I'm just gonna bring this one up. And I'm gonna put it on your sterile area. There you are. Alright. Okay. Go ahead.
Have to push this one here back, right? To become all that stuff.
That's right. But be sure that your needle is
Below the,
yeah, you're good. Yeah. Remember your that gap in the vial inside?
yeah.
You know this one here? That's what we're gonna do.
Oh.
We have 5 there, Lashes?
I'm going to take this out. This here.
He has dexterity, he's left and right-handed.
Yeah. Equally good or equally bad?
Pretty good actually.
I said that, didn't
Yeah,
I?
yes. It's pretty good actually because he can use, he has 2 hands to use.
Okay.
Yeah.
I'm pushing.
Mhm. So pull your needle back.
Need the back
Yeah.
Good.
Remember. Pull it.
and the floor. Yeah. Then I let this slit nerve
Pull back a little
pull
bit
back.
more.
Yeah.
And then pull this. Remember you wash your hands. Remember to sweep it?
Yeah.
Please. So that you can hold it with your mouth.
I can't do that.
Okay.
I can't.
Check whatever you can.
Yeah.
Okay? Yeah. As long as you remove everything
Yeah.
from the vial. You see how his fingers, they're too long. Nice.
Mm.
So he can play with a piston without contaminating it.
Mm.
Yeah.
Shall I pull it? Then
Yes.
it will come.
Put it more,
Yeah.
yeah? Until you get everything out from the vial. So did you take time off from work?
No, Wednesday afternoons I get off.
Oh, that's nice.
Yeah. Well, I'm on call, but
Oh, okay.
I just said I'd go in later.
You usually do a lot of calls from at Sturgeon Hospital? You go there
Stony, no, not
Stony
Stony
Plain.
Stony Plain. Yeah, I
Stony
work in
Plain
the
Hospital?
hospice in
Oh,
in the
okay.
basement.
Alright. I have one of the doctors, CF doctors, that I work with because I work on both programs, cystic
okay.
fibrosis.
Yeah.
Dr. Yaya is the doctor
okay.
that goes to Sturgeon
He
Hospital.
goes to Sturgeon.
Yeah.
Oh, nice. Is there a CF program for children and then one for adults? Like the
Now we
difference?
split.
Yeah.
I used to do both,
But
but in 2010 we split because there were more adults now. So my
Oh,
other
really?
colleague worked as a CF PAIDS coordinator and then I did adult. So right now I have about 190 patients as an
Oh,
adult.
wow.
Yeah. Getting there. I started with 62.
Um,
Yeah.
It doesn't come. I have to push this.
That's right. If you push it will above the fluid level so that it doesn't
Okay.
go, doesn't develop bubbles. And then when you're ready to take it to withdraw it, pull the needle out.
I'm going to squirt out
some in the air?
a little bit of liquid.
Sure. All the way to 5.
Mm-hmm. You still have that air at the center.
Oh, do it?
Yeah, I did it. Don't worry about me.
So,
Just pull out a little bit more.
yeah, well, if you go to 6 and then you get rid of the air, you hit the thing to get rid of the air, then you push to get to 5.
I don't know how to take that one.
Yeah. You see, remember your needle? It's above your fluid level. You have to pull it.
Put it
Pull it down. See, until the needle is below. See?
oh,
Yeah. We don't have home care to cover this because it's too complicated for them.
Yeah, I
Yeah.
figured. Those,
Okay.
but no pharmacy would do it? Really?
Your nose is still sore.
Unless, of course, probably you pay the pharmacist to do it.
Yeah.
Yeah. But the program doesn't cover pharmacy or home care here. So it's better for the patients to learn accurately and do it themselves rather than
It's
allow
lifelong.
anybody, right? Yeah. I did a program since 2000. Never had any patient with mistakes.
Really?
All these many years, yeah. I don't send him home unless I am comfortable.
You're the boss,
Yeah.
more than the doctors.
Yeah. No, we work as a team, so they know that the patient has to learn and to know how to do it by themselves.
You could be a millionaire.
What's that?
You could be a millionaire.
Yeah.
Nobody else.
So when I retire, so I think what I'm gonna do last is in when I retire,
Yeah.
I'll make my own private
Oh.
company and says, okay, I'll do all the mixing
Oh, yeah.
of Caripul.
yeah, that's good. You don't have to do the mixing.
Yeah. No, it's better off that
Or
you
you
guys
can
mix
get
it.
lessons
Yeah.
to teach the Caripul patients then.
Yeah.
It's not
Got it?
coming. Yeah, I can't get that last thing.
So what do you do at the evening? Just get it back
Okay,
to
your
sleep?
needle is still, you see, look at your needle.
Put your head
Below
back
or
to sleep.
Below,
every
you have to
time?
have still look below like
Oh,
this.
okay.
Right? Yeah. Below the fluid.
And just hold it.
Hold it and then you pull it. And you use this plunger to pull it.
Pull it.
Yeah. See, when you start pulling it, so you can see the fluid coming out. See? That it drops. That's alright, that's a technique, but that's okay. Put back again and do it once more. So that's the technique that Lasef likes because otherwise if you turn it as a, if you take it out, you have to poke it again.
Yeah.
So that way, but the thing though is if he is holding it, he normally what he did was he was rotating the needle that makes the hole bigger inside that vial, into that rubber vial.
Mhm.
So when it turns upside down, it drips.
Ah,
It used to be that the rubber, the top, this rubber here
yeah.
was very, very strong. So even if you poke it several times, it doesn't flick.
Mm.
This one,
Oh, really?
it leaks. That is all?
No, it's not really slowly.
That's good. Moving
Yeah.
your feet.
So what you do, you know what lasted
Oh, it feels
yesterday?
good.
He tilts it and then he pulls.
Pull.
Pull the thumb to draw it, right? See, if you do that,
The needle
yeah, that's why you
comes,
have to hold that. Good
Yeah.
technique, yes, that's the way to do it. And then you tilt this one here, tilt this one towards you, like that, and then pull. How the needle is playing with the fluid. Be careful that you don't put too much that you don't.
Mixed.
Or tip it and take it down.
It's all mixed up.
Looks like it, is.
No bubbles.
Yeah.
Looks good.
Okay.
You should put a
Very
little
good.
cream in
Yeah.
it and rub it in. You want me to do that? Take a little bit. Moist. Hold your hands close. You want to come out. You make that. Yeah, it's too
Then I
much.
take it out this.
Yes. Okay, thank you.
Papa, is she gonna eat anything? No.
No, they brought
It's
up
sitting
and-
here for a while, so.
And they said, the doctor said 2 days ago that she couldn't eat food. She couldn't use that thing there.
So why did they put in a
I
tray?
don't know.
Let me find out.
I asked the nurse once, and they were gonna look into it.
We could. Come on,
Cheers.
no blame us.
I'm not blaming her. I'm just saying,
Say how?
Yeah.
Okay.
I'm just saying that they said you couldn't have it, now all of a sudden they're saying you can eat it.
Thank you.
Well, you can eat it, but anything.
Oh, I don't want it.
Why?
Yeah.
Yes.
Yeah, so,
Oh,
roast
why?
it first. So
Well,
what you do with this
I'm
one is
hungry.
when you do this, right?
You sent me
Yeah.
downstairs once and I did eat, remember?
Nothing, forget it. Man,
Not yet, hold on to that because
When I went
it's.
downstairs, Grace. I had a bowl of
you want me to
soup.
have to
I had a bowl of macaroni soup.
Huh?
I had a bowl of that macaroni soup.
Family, they said she can eat, Papa.
Yeah, that's-
Yeah, the doctors have
Yeah.
decided today they want to try to eat plus getting the 2 feet.
yeah, well, that thing was sitting there for an hour now.
Yeah, it's been sitting here for a long time, so my thing is, do you wanna feed her or no?
Well, I could try to feed her, yeah.
Yeah, I can.
Warm up.
Yeah, I'm gonna take a trip.
yeah, I didn't eat it, now.
At least an hour is cooking it, so we don't have to waste it.
When you eat, you not ready.
That's the reason why we don't, you always stop.
You see one thing and then they wanna do something else. Quick.
Okay.
Make supper, we'll set it out for pizza.
Yeah. Yeah, because the nurse was gonna come back and tell us,
Mom, your mom poked her
Poke
fingers. Yeah.
You okay, Mom?
Yeah.
Mom,
What, you go to the movies?
dangerous.
well, the movies.
I don't know if
A camping
it's
and
interesting, but it's dangerous.
Just gonna try to feed you a little bit, eat a little bit.
What is that?
Okay.
Yeah, that'd be scared to
Take it out first.
do it. When we were hot, I'd be scared to do it.
You will be scared to do it?
Well, they said she could choke on it, get it in their lungs and everything.
Yeah.
Cover your needle. See how pretty good he is? Getting moving all the medications there? Yeah.
Just go off this place,
Now I'm going to tap.
So how many do you have?
There. Here comes.
It's
food
over
back.
over 6.
But there's air.
Yeah, I know.
So what about if you pull back the plunger? Pull it out first. Yeah.
Cool.
That is
Just put it
Scottish
on.
dish.
I
and then push the air
No.
out.
Okay.
Then you'll exactly probably have total of 5. So now stop.
Hey,
Look at that.
Nothing.
5.
8. Ah, that's what they're saying. Up there.
Don't worry about the air because remember we are going to collect air later on.
Oh,
Yeah. As long as you took out all everything in that vial, you put in approximately 5. You took out 5. Don't worry about the air.
okay.
Mashed potato.
I throw the needle away.
Yes. Needle away.
Uh-huh.
Then you get a fresh needle.
So, good job. Okay.
Potatoes up.
I'm going to take this spark sharp out.
Yesterday, I had
Yeah.
I'm not bloated.
You feel bloated?
I feel bloated.
You feel bloated?
Yeah,
Yeah.
I'm sore.
The soreness is a little bit normal. Bloated maybe is also normal because you're getting fed like continuously. So we will
Yeah.
see.
Very good.
Do you feel hungry at all?
Oh no.
I'm
No?
flat.
Just like try something.
Very good. Yes.
Maybe if you try to eat, you start eating normally, then you stop this one and just start feeding like normally.
That'd be
Yeah.
nice, wouldn't it?
There is some chocolate pudding.
That's always hard
You like
to
chocolate?
clamp and clamp.
Yeah.
It's
Just
Women
skin.
don't like it.
She likes Mars bars.
Okay.
Yeah? Those ones will be hard to chew on.
Squeeze.
One moment.
Oh, thank you. I feel like I'm over here.
very good. You're doing great.
You know, the fact that you like chocolate, let's get the chocolate in at least. You want to get the chocolate at dessert?
Well, thank you.
Well, I'm glad she could.
Are you sure?
Yeah.
Some,
I
some,
feel like I've been too positive.
yeah, just taste
You
the
put
chocolate.
this
at
here,
least.
right?
See what the taste of it. You want some
Okay.
more?
No, honest.
Okay.
Clap.
That's okay.
I appreciate it.
No worries. We can wait here.
I don't know why they let me eat so soon after you. You know,
Yeah.
I feel way out of here. Very
No, the other side. Other one.
Your
One thing
stomach's
your
still
cassette.
soft.
Yeah.
Yeah.
Remember
Oh.
the
Maybe
set.
because of
Yes.
this you
Yeah.
feel full. Yeah. Okay?
Thank you.
You're welcome.
And don't worry, it happens all the
You can try
time.
us out.
Yeah.
Neither day.
Chicken.
Yeah, she swallowed up.
Yeah.
Okay, so that's done.
Yes,
Go down.
Good
Good job. Two down.
Pull your thumb.
Yeah, the way they're talking.
You want, you want to try? You want to try at least a drink to see how it's gonna go. This is
A little sip of juice, whatever it is, no?
No, I gotta go eat them.
This is
Oh,
the
chocolate,
worst
chocolate.
director
Rabbit arms.
video
I
I've
feel
ever
like
seen.
I'm every time.
It's like there's like
It's a nice view outside.
Yeah.
People get bored.
Yeah.
1 hour and 45 minute video on YouTube.
You shouldn't go down that fast.
Air. Where's your air?
Yeah, you know when you eat,
Always
don't
remember to take
rush.
out air.
Take your time to swallow.
Yeah.
Yeah.
Is that too soon after Monday?
That's
You
6.
know, it's as long it's you who said it's too soon.
Different people?
No, it seems that's
it's
why.
fine. These my mama.
I just want to try to see how you're gonna drink it.
I mean,
You
not
got
all
it.
my family.
No, this is not alcohol. It's like milk.
I should have like them.
Okay, maybe a sip.
At least
I
beer.
should have done this before.
It's okay.
This is like milk, thickened milk. Yeah.
Yeah.
Okay, so it's okay. One more sip just to see how it goes.
By the way,
No air?
Very good. No air.
thank
And
you.
you got
You're
5.
welcome.
Yes.
Yeah.
Not bad.
Or take it out, right?
If this chair was just wider,
Always cover.
Wide on the widest.
Jason
let
won't
him
walk
try.
this way.
Oh, you won't.
Put your needle
You
in.
can't fall off. Okay?
Huh?
There's railings on the side, you can't fall.
You're amazing, Sandhya.
You take
By just watching it, you know, he's very thorough with her. Look at mom.
Yeah,
Yeah. Just watching you.
really.
Yeah.
Mm-hmm.
Everything I do, and then she has to wait 5 minutes, 10 minutes until I do it, and then she.
I'm just rubbing that little bit of cream into your, like your fingers here, okay? Yeah. Keep your skin nice and soft. It is nice and soft right now.
Now remember not to touch the.
Oh, here.
Yes. Not yet. You have not injected the medication yet. Yeah.
Feel good?
Yeah.
Feel it cream in your hands, you eat a little bit of food, that's good.
You see how good your technique is now?
That's really good.
Yes.
Yeah, I'm good.
Every day as you mix, it your techniques are getting perfect.
It's like out of a restaurant.
Not that way.
Yeah,
Remember, if you do it that way,
Yeah.
the medication, the
it's like a
hole
restaurant.
gets big.
Food every day, right?
So you have to roll it. Remember what last week was doing? He rolls it all the way, like lacking it, because otherwise you see the hole there gets bigger.
Yeah.
And when you turn this upside down,
Hi.
fluid will
Wow.
Yeah.
Right, Kim?
That cream is like green.
Is that good?
Very good.
Feels good?
You want it bad, right?
No. I want Josette actually.
Yeah,
Look at what Gord found from BC.
they have, yes. I showed this to Dr. Lee, and he said, no, we have our own system.
But if we tweak it to what our system is.
Yes. I actually sent this to
I'm,
him, and he said,
like the whole
And he
the
said
whole
to
thing,
me,
syringe
I
and
like
the
your
bottle.
old way of
Yeah,
doing it.
you're right.
This is too complicated.
Okay, so after you're done,
What I'm gonna do is I'm gonna get it from my
Yeah.
tomorrow from my office.
Okay.
Because we have those handwritten orders.
Right.
Yeah.
perfect.
Okay.
Good.
But I have this, yes. Yeah. And it's nice.
That's what I kind of wanted.
Mm-hmm.
Like notify
Yes.
Josette. You know,
Yes.
here's the way.
yes,
Here's
Yeah. And that's the one. Yeah.
obviously we don't use this anymore
No
or
more.
this. Because
Yeah. That's
I mean,
confusing.
this is just a start, right?
Yes. Yeah.
And then adding to your stuff.
You see over there, they have a nurse practitioner. So in BC, in
Yeah, that's
Vancouver,
it.
they have a nurse practitioner who teaches everyone, and they have two nurses who follow up the patients.
Hopefully we'll have that one day.
Yes.
But I love it. Like
It
this is
is.
what I'm looking for. One pager, nice and simple.
Just like
Done.
this. Yes.
Yep.
Right.
One page. Okay.
Yeah. So when I asked one of the nurses, her name is Lisa. I asked her to give me a copy of this, and when I gave it to Dr. Lin, he said no.
Make
I
it
said
one
we'll,
page.
we'll tweak it
Yeah, we'll tweak
Yeah.
it. Okay, so tomorrow then? Not today.
tomorrow. Tomorrow.
Okay. Okay, thanks, Josette.
You're welcome.
Awesome.
All right.
See, is it possible I have a bubble
Mm-hmm.
and then I lose it?
What do you mean by lose it?
Like,
Get rid of it.
yeah.
Mm-hmm. You remember you said that that's always your problem there. Yeah. So you remember you want to put that bubble at the center of that,
Yeah.
yeah, and then push it back to the vial. So what you do is, as what your brother said, get more of the fluid up to 6, and then push push it back to the vial, and get a total of 5.
I always problem with taking the bone
Yeah, but remember your needle, where's your needle? Too
below
high.
below the one.
Yes,
right?
below. Yeah. And, oh, yes.
And push it.
Where's the cushion?
Yeah.
Where's the cushion?
That's good. I flip, right?
And you pull.
Mm-hmm.
Then afterwards it's going in, and then you pull your needle a little bit. Not in there. Not in there. Not in there. Here.
Yeah.
Pull it all the way. Remember that area there?
Yeah.
That's where the tip of your needle should go. There.
Then I'll push it.
Then you pull it. You draw it up more by always remember to hold it, because otherwise your needle will come out, right? Remember that two fingers you have? Yeah.
You know what I like?
Mm-hmm.
When you put the carpal in there, and then finally clear it. 'Cause
The ones that I was giving you as your practice are old Caripul. So it's very hard to mix. And there's always some problems at the bottom.
yeah, it's
And the labeling to us changed. Remember when one of the patients was telling me that the labeling is too big, that you can see the picture of the medications inside once mixed.
Mm.
So as compared to this, that's the labeling.
You can
Whereas
see.
that one there is better, you can see. See?
Yeah.
And we asked them to cut this neck a little bit shorter and make the rubber inside shorter, because that's where most of the medications are hot. It's very hard to get it. I like your hands and your fingers together. Yes. Pull it. Yeah. Okay. Good.
I have some.
More? Okay, that's
Yeah.
what you will draw more. Right up more.
Yeah. Like this. Draw.
That should be good, I think you're doing it right, because you remember this is an old vial, so some of them are hard to take it out. So technique is good.
okay.
Very good.
Turn it to the where you can see it.
Oh,
There's a, where the label isn't. You know, we can
Take
see
it
if
out
there's any
now?
white powder.
yeah.
If there's no white powder, you mix it all. See where the label ends?
Yeah.
That's your glimpse into the bottle to see if there's white powder if you mixed it all. Turn it around so you can look at it.
Oh, yeah.
Now shall I put it into the
You see the white powder?
cassette?
One of what?
These are my
Then you're
bones.
good.
This is the first time he's using this new batch of
Oh, really?
vials, that's why.
How come
Yeah.
they took
You're
your needle out?
swallowing okay right now?
Oh,
That's okay, yeah. So when he's doing it, there's nobody who talks to him, so he just
Yeah.
mixes it, yeah. That's okay. It's happens sometimes, yeah.
squeeze.
How are you? Are you here for
For HPT.
yeah, he's gonna go home.
Oh, no, he's went, oh, did he not hear?
Go home?
Yeah. He was, they had written an order for ceftazidime, six grams, over
24 hours, yeah. That's the
They
first
gave,
time.
they gave it over 4 hours.
No.
On the unit last night.
And, oh,
Listen there.
Nothing happened, but then they were just like wondering they were checking everything, so we finally got him out. But then now he's already been phoning, yelling at me because he wants to disconnect from his pump. And the home care is out there told him I can't, but he actually, I discussed with him, and he was causing trouble. And he just left this morning at
Oh, it's
10:30.
only quarter just.
And it's a 24-hour dosing, so you cannot take it out.
We're not doing that. We're doing the
It's
intermittent
device.
dose.
How do you wanna know that?
Because it's him. And I said, you're still on the pump, but you can disconnect and everything. So,
Mhm,
yeah.
We talked about it yesterday. I said I think that's a good technique because they're trying to do
Nothing.
a 24-hour dosing so that the strength of the medication is stable for 24 hours.
Okay. Yeah.
Yeah.
But for him, he would never wear the pump for that long. I know. So, because yeah, we were just told in the report this morning there was, and then so I went and I'm like, oh no.
Yeah, I know that you called me, but I was doing my other hand.
Yeah, I just want to I let Chris know that that was what was going on. So he's gone. He's there already causing trouble. So. Anyway, all right.
Reminder for tomorrow. Okay?
Pardon?
The village,
Oh, that's right. Tomorrow evening. That's right.
5:30 to 6 is the arrival.
That's right. Okay. I'll
All
be
right,
there.
thank you. Yeah,
Good.
that's my other hat.
Hmm.
Yeah. Yep.
Did you get all of your?
Right. Yeah.
Liquid?
Okay.
Wanna see my gloves? See the glimpse?
A glimpse? You got it off.
I think so. So,
Now just be sure that you don't put your vial on your sterile area. Yeah. Make it a little bit of a gap there. Okay.
alright, now
Okay.
I have a concentration. Now I'm gonna take this out. Now I'm gonna scoop.
I get this one, right?
Yeah. So you have your last one.
Yeah.
No, hold here.
Yeah, I put it far.
Yeah.
Yeah. So,
But we're not touching.
oh,
Now,
So do we have exactly 5 there?
Did we have a speaker
oh,
on the chair?
What?
Did we have a one chair?
Oh, yeah.
Approximate.
Yeah, we just sat in them lots of times. Right? I'd like to get some shampoo pretty soon.
it's okay.
On the carpet.
Yeah. Good.
Take this out and take the red. Get rid of the sharp.
Okay, sharp, sure.
you know what I do?
That is 3.
I think I have finished all the markets, right?
Yep.
I put it
Don't think
this
it-
one upside down
Mm-hmm.
You're doing this
and
fast.
take it off.
Oh, I'm not sure.
And this one.
Yes.
You're doing it. You
But
seem
you
to
forgot
have
to
a
swab
good
your
process
Caripul.
now.
Oh yeah.
Yeah.
You want to get to the point where it's like procedural memory, right? Just like riding a bike. Just
I used to-
natural.
I
Natural.
used to do that maybe 20 years ago. Maybe I'm out of it. Maybe I don't know how to.
Maybe in 3 to 6 months' time, you'll have your lung transplant. Then you don't have to mix it anymore.
That's the
Yeah.
plan.
Yeah.
That's the plan.
Yeah, that's nice.
You might get it so sooner than you expect, you know.
Is the lung transplant the anti-rejection medication all oral?
Oral.
No. Nothing sub-Q or.
No, it's all oral, but first, I think, in the first few days, they're giving them IV
In the hospital.
in the hospital, in ICU, CVICU. Yeah. The good thing about this is because mostly for some patients who are assessed for transplant, they will still do the 1 month of 1 month of rehab just to test their compliance, right? Because they have to come every day, do their exercise, go and be seen in the clinic 2 times a week. So that's the compliance for all that's the compliance aspect of the program. But when they are on Caripul, sometimes their status is elevated just because they can see by doing this there's the
They're better
compliance.
compliance?
Yes. Yeah.
Interesting.
Yeah. So actually Dr. Harwan said that, I told them that he's really good.
Yeah.
So he said, okay, let's up the status. So you'll never know.
Oh, this doctor.
Don't throw it away.
I know.
Just Marianne is wanting to take in 500 maybe, but maybe she'll-
Marianne Collage? Okay.
Great deal.
Doctor who?
Holland? Holland?
I was going my mom with Gunda.
I have to
Get all the
get
liquid.
back to
Did you mix it all?
Yeah, I mix it. Now take it out, take into this. That's it.
There's no white powder at the bottom there? Oh, yeah.
No. So I put it, this one here, like that.
You
How
can
much
push
faster
the, you can push the
I don't know
air
if I can be on this bed.
in.
Yeah, like this.
Huh?
Push what?
You let it take?
Push so you have lots of air in your syringe. So you might not have enough space for 5 millimeters. So you can push it all back.
Into
Lay
water.
on your bed.
On whose bed? On your bed? There's no other bed here, just this one.
Over that side
Bed
down
you're
here.
talking
I
about?
thought, yeah.
Pull your needle back to underneath the water.
Off of it.
So that the needle's always in the water, not in the air. And then pull out 5 millimeters.
Oh,
Make sure your needle is under the water.
not coming more.
100%.
Yeah, pull out.
I'm talking next
Pull
door.
it out more.
Not the needle.
The cylinder.
Keep on all the liquid.
How's your arm? Is it getting better?
Huh?
Your
But
shoulder
I
getting
have
better?
about
You
six.
fix it.
That's okay, because you have some.
Yeah.
Yeah. I have to take it out there.
Can we
Yeah.
fix some?
You don't have to right now. The most important thing is you got all the liquid out of the bottle.
Hope it's nice. What did she say?
The bed,
Yeah,
she's not,
see,
she's bad.
there's no liquid in the bottle.
She's all looks good.
I think I saw her once before.
Yeah.
I think I did. She was just a little.
Now I put this into the
Did she get an operation?
Who?
into the cassette, right?
Guy next door?
From this old guy.
Yeah, he's had that already.
Oh,
Same as you yesterday, same as you.
oh. Don't break them, I'll pull her out.
No, I know that. That's why I don't like the end of it all.
Gonna push it up.
When you get out of here, we'll have to go get you there.
Huh?
When you get out of here, we'll get you there. Time it is up right now?
Huh?
See what time it is?
Huh?
3 o'clock. In the afternoon.
What is it, a movie?
No, that's just the time it is.
Not that fast.
So were you the one who went shopping for this tray?
What?
Actually, my wife
You
had
did.
one baking,
Yeah.
that's our baking tray, and
Yeah.
No, you haven't.
I bought this for him.
Ah, just to exercise.
Yeah.
Yeah.
'Cause I was watching the video
Mm-hmm.
to help him get strength in his hands. So
Yeah.
pull this
Okay,
around.
now I
Whatever you do.
just a big cylinder, right?
Yes.
This one,
Good enough.
take
Yeah.
it out.
Put 'em
We're
on
gonna
there,
leave
you
it
put 'em on.
because you know you covered it with red cap later on
Yeah,
after
very
you're done.
much good.
Yeah.
That's good to break them. Is that better?
So the total volume in the cassette should be 100. Regardless of the number of vials you mix, it's still 100 because there's 50 ml in 2 vials of the sterile water for injection.
Mm-hmm.
So we withdraw 5 ml for each vial, and then you add the remaining
So 80 mils.
sterile water into the cassette to total of 100
How
ml.
about maybe your mom's little one?
So the concentration is fixed for him?
No,
So,
the diluent is fixed as 100 ml,
uh-huh.
and the volume in the cassette is fixed as 100 ml. The concentration changes according to the need to increase the concentration.
So how does he
because over
adjust the
time-
concentration?
The doctor tells me every time.
But I mean, like,
When the pump reaches 3.8 ml per hour,
uh-huh.
that's the maximum rate.
Okay.
So then we have to change the concentration.
Okay.
Otherwise, he will not be getting enough
So
medication
to-
to last him for 24
To
hours.
adjust to his dose, it's the rate, right? Like, let's say they just bump it up a little bit.
Yeah.
Then all he has to do is change the rate. He still
Change-
does 4 bottles,
Yes.
5 mils,
Yes.
100 mils in the
Yes.
cassette. None of that changes.
None of that changes as long as the rate is below 3.8.
3.8. And
Once
then if
it goes
goes
beyond,
then you need more vials.
Another vial.
Okay. Well, that's easy. So the pump is the only thing that adjusting the
Okay.
Good?
I was wondering if you had to do like math to like figure
No,
out
actually it's a
exactly how much
doctor.
to dilute.
I teach him though because he's good at math.
Yeah.
But the doctor does all the
It's a hobby.
they do all the calculation and they will just tell Lasset,
What
okay Lasset, increase your rate to 2.5.
Okay.
But he will need blood pressure machine at home
Okay.
because he needs to check his blood pressure every day. This medication drops the blood pressure down a little
Okay.
bit.
So I'll have to get
And the weight should always be checked every day as well.
Do you have a scale at home, Mama?
Yeah.
Just have to get a blood pressure machine.
Yeah.
We can get a prescription so that if you're underage, I think age covers it.
Yeah.
Yeah.
Are you laying down?
No,
Control.
sitting in a chair.
Now, you remember you only put 20, how many do you need? There's
Sure,
5, 10, 15,
Hey,
5, 10, 15,
20, 30.
no, no
Yeah,
complicated
I have
Yeah.
to take it out.
Yeah, because otherwise it's going to be too
We're
much.
in there.
So, 30.
30.
I wish they could.
I always tell them that they said it's 50, but it's more than 50.
Mm.
Yeah, so they have only to get 50 out of the 50 ml vial.
Yeah.
Sometimes,
30.
yeah, very good. Yeah,
This line,
the
the
big line.
big line.
Mhm. So remember the pump, release, pump, release.
Release. Yeah. I lubricate. Yeah.
Yes.
Lubricate.
So remember you put this on the table,
Table. Yeah.
then you hold on to this,
And
Hold on
hold
to
on to the syringe, you push, and release. Okay? So this is what happens when the needle
Yeah,
is,
right,
the vial is
totally,
poked
yeah.
several times.
Yeah.
yeah.
Yeah, there will be lots of fluids coming out. So I think what you should do is release, because there's too much pressure inside the bottle.
Take release.
So at home, when this happens, that it's dripping so much, what you can do is just do it this way. You pull.
Okay.
Needle should be full of fluid.
Have all the liquids.
I don't think it goes all of it.
So you push this way,
But this again.
and then release.
Hey,
And then you pull all the way. So don't worry about this because it will happen to us
Yeah.
home or it's gonna leak. Just do it this way. And you get extra fluid and then just discard. Because sometimes there will be something there. Like for example this one here. Okay? So if you do it this way, do the bubble first. Okay. Alright. Now then hold your syringe and remove all the air. There. Now how many do you have now?
30. About 20.
So you're about 30.
30.
So you push it all the way up to make a bottle.
This one here?
Yeah. Push it slowly until you reach 30. There. That's your 30. So your 30 is in line with this big
That
one.
one. Yeah. Now I'll put it in the
Okay.
thank you.
6 pack one.
some blood pressure here, okay?
What are your tips for this?
Oops. You're trying to get out the oxygen? The listed thing?
The liquid.
As long as the tip of your needle is in the liquid, then you'll be able to get it.
Is your neck breaking?
Try to angle. You were doing an angling of the needle, right? So you.
Is it okay?
All kinds of food in my stomach.
Looks like you got it off.
No, just a little bit.
She told me she had 6 hamburgers this morning.
You didn't find it
It's okay.
bad.
Sure.
Any more about the actress?
Your last vial. So this one here, there's this it's blocked, right? So what I do with this one is I angle it this way.
My chest is
This one here is good.
Chest is good.
This
So,
one is not.
so if we
So
should
these are the ones that I keep practicing on patients. That it has to be totally
yeah, it's almost done, almost done.
empty, yeah, because otherwise concentration is it makes you
Yeah, it's coming down, it's coming down.
This is the most challenging how to get rid of all this.
It's coming down, it's coming down.
Oh, it's not. Get their techniques, and then
please go.
by next week he should be able to get rid of all those.
Bottle design.
It's the bottle design. So when actually the other
It sits
medication,
there
yeah.
above.
Is it tight on your
You know the
arm?
other Flolan vial that we use, like I was using Flolan for the last 10 years.
What's happened?
The angle of the vial and the rubber inside is better. So you exactly can get all the medications. And I've been telling them that there's a problem because the medication is hot once
Yeah.
it's caught into this
Between the plastic.
between the plastic.
Yeah. I stopped it, I stopped it. I stopped
Okay.
it. Here, I stopped it. Okay?
Gotcha.
I should be
Why did you
touching
do
the
that?
sterile.
What's happening?
The gauze here?
Yeah, try to take some deep
So
breaths.
this is the other vial that I used. The
Okay,
Flolan
stop it,
vial.
stop it the cuffs,
It
okay?
mixes faster than
It's
this.
up.
The only thing problem with this one is you have
Stop with the
to
cuff, okay? You're doing okay, just try to
it
breathe.
has to be when you it's given to the cassette. It has to be
I know.
refrigerated. So you have ice packs in between to keep the temperature between 2 to 4 degrees centigrade. Whereas this one, it's on room temperature.
Yeah.
So I have to take 50 from
50,
there.
yeah.
You don't, yeah, you don't need to go pee, you have a catheter, okay?
Oh,
Good jobs.
Good job. Yes.
Right, now, should I throw this away? Or?
Mhm.
There we are. You're doing great.
So how much is it? Does the filter and the pump get rid of the air if there's air in there?
They prime. He will prime
I
the
think we
tubing.
need to-
I will show you later on when he does
You
it.
find
Yeah.
that it's hard to breathe?
The machine will prime the
So
tubing.
maybe we need to go on the machine for a little bit. No, you don't need to walk.
So
Okay?
the machine is
Just
easy
gonna
for him.
put you on the machine for a little bit, okay?
It's just this mixing. And everyone does this all these years. It's always very concentration because of the position of the
bag
dog.
out of there. You know, for breathing. She says, I'll put her on that, but she never took the bag and never come back.
Yeah.
And they always have partners.
Yeah.
Just in case something happens to that they're too sick or too tired, somebody can troubleshoot and mix the medications. You're lucky your brother is a doctor. He can mix it whenever you need
I'm
it.
telling you.
Don't tell him that. This guy, 5 minutes before I get to the hospital, I have jalapenos and sardines and
Banana peppers.
banana peppers. Oh, you're already at the hospital? Oh,
But
wow.
he's such an idiot. He doesn't even know how to make a sandwich.
So now we're gonna go on the machine, okay? It's gonna help you breathe better.
So ask him, what was that herb?
You have to go all the way up.
Lubrication.
How do you stop in between? Because it's so hard.
Yeah.
You release until it stops drinking and then
Yeah.
push it up again.
It's good, eh?
Yeah.
Alright, so 20 plus 30 is 50.
You getting better?
That's good you got these needles without the safety.
No, we can't keep the safety. Yeah,
That's good.
yeah. It's going to be very hard for them to use the safety needle. The
I
only
didn't
thing,
know that they produce those still.
only for this patients.
Yeah.
Yeah.
Oh, really?
They used to have 18 gauge needle
Yeah.
when I took over the program in 1999, and I said, oh my God, it's easier to withdraw, but just in case patients have unsteady hands, one day hope the patients sign. I said needle should be smaller, which is 20 gauge,
Yeah.
and shorter. It used to be 1.5 inches length. But you know, for small people, their hands are smaller.
Yeah.
So if you keep on pulling the needle out to get all the medications, you know, when you're drawing it, it's too long.
Yeah.
Yeah.
Okay, I'm going to poke this here.
Mm-hmm.
And I'm going to squeeze out.
Or you turn it upside down, right? Yeah. Whichever
First
you
or,
want.
first or what?
It would be easier.
Oh,
Push it down later.
Yeah.
okay, you see that? It jumps.
How's it going, Mom? How much you need, Emma?
Is it better?
50.
50?
Okay. So if I have a hole and the hole is making me wet, what's the plan?
So if it's a hole and it's big, there are two ways you can do. Instead of doing it that way, you can use the other method where you hold it like this and then just pull so that it's faster.
Oh, that's faster.
Yeah, it's faster than push and pull. Besides, you're only getting 30 ml of the fluid from the vial, not 50. So all you have to do is just draw it all up until you get 30. Discard whatever you have that is more than 30.
Okay, I'll come back in a minute to check your blood pressure, okay?
How many do you have?
What do you have here?
It's about 250. Yeah.
Well, that's gotta stay there. That's
So
for
what
sure.
you can do is you remove your ear, take it out,
Take it out.
yeah, take it out,
I heard, I heard
cover your needle.
Get to 30, right?
Yeah, I have it, but I'm not there.
Hey,
Huh?
no,
You have 30 or you
No,
have
I
more
don't
than
have
30?
30.
okay.
So
You
get to
don't
30.
have, yeah,
So
you have to,
discard.
Just poke down.
See, this is here, it's gotta be on your finger bit.
Actually, that's why not
This here.
do that then? Why not make a new hole?
Yeah, you have
It's
to
not
make a
gonna
new
move it
hole.
on your belly, it's gotta be on your finger.
And upside down,
Because you're pushing liquid, not air.
there,
Put it this way.
and then you push the air back.
So you get to 30.
Very good.
Just like the small syringes, right?
Yeah.
So
Still
like
hot, yeah.
5 mils in those, that's when you want 30.
Yeah, it's starting to work again. It tells your heartbeat.
Okay, you have more than 30,
So you
right?
push first. How many do you have?
I'm not sure.
You have more than 30. So you're good.
So you have
So
to
squeeze it out.
Squeeze out the air until you get to 30.
That's okay. Yeah. Let's use this one to cover it because
You don't have any air bubbles, right?
you're not using the one anymore. So what you do
I have a bubble.
is get it like
So you get
this.
rid of the air bubbles, right?
You draw and push all the way. How many do you have?
Hold it straight up and push up.
Hey? No. She didn't want you to put that on for a while.
So shall I put it
She's
in?
scared of that one.
No, I'm not putting this now. Just there's a leak in your mask. I'm trying to fix it. That's all. No. I'm gonna let you rest a little bit.
This is not a bubble. I have
A little more than 30.
it's too much.
More than 30. That's a big one.
No.
You have 30?
Yes. No. Well, no, I don't because I have this bubble.
Finger,
now.
finger?
See, I have it.
You want it on
I
this
have
finger?
it. And then
Okay. Shove it,
the
put it
new
on there.
bubble comes up.
Where? Oh, okay. So drop. So there's are two things you can do.
Don't put your hand in over it.
Take
Put
out
your-
everything in that vial because you'll get more than 30.
Okay.
Just take out, you draw out more of the medication, of the fluid in that vial. Take it out all.
Alright.
Yeah.
Take it out. Take
Take out all the fluid from the.
out of the fluid. Okay.
Your needle should be below the fluid level, otherwise it suctions air. Okay.
Oh,
Got it all?
I think so.
Okay, now you can take out your needle from your vial. Yeah. No, you don't have to now. Just take it out. There. Now cover your needle. Okay. Alright, so before you do anything, check that you have no air in the. Don't push first. Check your vial. Do you have any air?
Yes. Yeah.
Yes, so just tap it. always remember your syringe should be up, not an angle, straight. And then push back until you get 30.
I have to
Yes.
take out the bubbles.
With the air. No, you mixed.
Yeah.
You mixed your cassette.
Yeah.
There. So this is what we do after. They mix it by turning it. At the same time, they're mixing the medications. At the same time, they get rid of all the small bubbles to form a big bubble, and then they suction it out. So there should no be air inside the cassette. I don't. It's still more than 30.
Oh yeah. But
There should be 30.
no, but it sucks it out. You notice that? Like the 30 sucks down back towards 40.
Yeah, almost. Yeah, almost. One more. Push a little bit more. Good. That's 30.
Okay.
That's your 30.
Okay.
Okay. All right.
Has been bubbles.
See any bubbles?
Don't take it off. Every week.
This way.
Take it off again. I'll come back.
Good.
They put that mask on so we can breathe better,
Same thing. You put it on your.
right?
Yeah.
And then you suction it.
How do I do that?
You release your hand. There. Okay. And you wait
And
until
they
it
kill
clears.
the.
Remember all the
Mix
steps.
back.
It's good.
Okay?
Steps.
I looked at
Just
the
the
numbers.
time
Look
that
at
it
it now.
takes to get these bubbles out and
Oh, it
sucking.
doesn't matter.
Maybe it was that food and everything that made you hurt.
When you
I'm
learn-
bad at sucking though. Think about that.
No, you're good. Actually, you just have to push it
Hard.
into the cassette. Because remember, eventually the air will be taken out when you mix all the 100 mLs.
You tell med students you don't try to be quick when you start. You're trying to do all the right steps first.
Matter.
Take all the time you need to make sure you don't make mistakes.
Hey.
Cut corners.
I can't hear you, babe.
You can get faster in the future, but if you do it right, if you learn how to do it right, that's the most important
Okay?
time.
Let's go on there. Let's not.
You can pull back.
Okay.
Come in.
You can pull back a little bit.
Pull back.
Good.
You know, the red cup, right?
So pull. Until you see the medications dripping into the syringe, and then you can pull. There you
I
are.
don't know what you're saying.
Now you can flash.
I'm sorry. I'm gonna get a nurse to come in here and check it. Not him. Nurse.
Alright, so what's the next step? Okay, now check your cassette for the second time and see that there is no air.
Hey?
Good?
Oh, that's a nurse for that boy next door.
Very good.
She's a nurse for the boy next door.
Okay, so now you can label it.
Almost finished.
Oh,
Everything looks good.
Huh?
Your mom?
Your hair is good.
She was watching you for how many days now?
Like that.
Yeah.
Okay, you can label it.
Just got stronger hands than you.
Really?
Yeah. I think her fingers, her hands are stronger than yours. That's why.
Dose of Caripul.
So your dose is
And
37.
use in one hand, 2
Is that
minutes.
fast? Go pit rate?
You haven't been
I'll check that out when we finish.
haven't been getting the practice
do it
in the
on the
last
internet.
3 months.
Yeah.
3.4. That's ml per hour. And your concentration is
Hashtag
4
sexting.
vials.
Yeah, she said something with your
4
boss.
vials.
Another guy was in
Yeah.
here, he
We
took your
as
blood
in
pressure, and he started yelling at the water, your chest was sore.
ALS.
Grace, what's the problem?
Yeah. In 1,
I pull it down.
4 vials, 1.5.
You want it out? 1.5.
Yeah, 1.5.
Down a little bit. I'll let this.
Oh, okay, yeah. That looks fine.
Right? And then the name.
That's it.
Yeah. And just put
Your
L.
blood pressure, what made her start hollering? Took your blood pressure while ago, just started hollering. The whole driving her chest.
Date.
I think she was just having a bit more
The whole
difficulty
last name.
breathing. That's what we have
Nobody
to
want
find
to
out
know
now.
who is
Yeah,
I
L.
need to start following out a bit.
Once
And then
you
the
take
date.
blood pressure,
You mix it.
calm down a bit.
Maybe the squeezing of the cup too, maybe it was a bit uncomfortable for everybody here. But let me try to fix
You
this.
don't
It
need
looks
to
okay.
worry about pushing it. You just flip it over.
325.
For the bigger syringe, it's harder to do just by your
And
hand.
everything, it's not leaking. The settings are fine.
Very good.
Okay,
Then
You just wanted to see this guy, that's all.
Then you can release and get some in.
is that the right way?
So with the
This
needles
one should
below
always
both
be on
ways.
the right side.
Right side. So it has to be left side? No.
Let me see that. Let's have a look on the pump.
Yeah, she's a nurse, but there.
It's a skinny needle.
Get an
There's
observation.
only so much that can come.
Then you go.
Let me take the big pillow on the
So
way,
the
so you can
palm.
relax more. The neck won't be twisted. You like it, guy? What would you like me to do?
So, square.
Well, she's going next door to the boy.
That, yeah.
So you have to turn the other side.
Okay.
So this is the pump. This is a cat pump. So this is what we use when we prime the tube.
Does it get extra batteries and stuff?
There's 2 batteries and they're always provided batteries to last them for a year, for a month. They change the batteries every 6 days, but you use the pump alternating 3 days.
Every 6 days you have to change the battery?
Yes, but you use the pump every 3 days. So you use the pump twice before you change the battery. Very good?
Yeah.
Okay. Now I want you to attach your pump, your cassette to the pump, and prime your tubing. Okay? Alright. So mom will be doing the priming. Okay. So we program the pump first before you prime. Always hook it to the
Feel good?
always no. Remember? Hook this
This one.
in here.
This one here.
And then you push it against the, push it all the way down. And then lock it. To the front. While you lock it, you have to push it all the way. No, it's under. Push it like this. the capacity start. Now the seam should be straight. Very good. So this is the seam straight. So that's long. Okay, good. Alright, now I want you to program the pump.
It's too big.
So you can do the same thing as before. You take out all the liquids, take all the liquid more than 50 from the vial, and then get rid of it.
You'll be okay now.
Suck out all the liquid.
Oh, it's just all of it.
Yeah. More
Again,
than 50.
you remember you have to program the pump first. So how do you,
What can I
how do
do?
you turn it on?
Not me.
Start, you know,
The machine is off.
I'm supposed to know what he's doing.
Here's the zone.
on.
Hold it. There.
Don't let him touch it anymore.
Then it will tell you what to do.
Somebody else. Okay?
Okay.
Get rid of the valve.
Just pull it out like this way.
Or
I don't know what
cap
you're
it.
trying to do.
Okay.
I don't know what that is.
But have you poked it out?
Sorry.
Sure.
Okay. Now when the machine is stopped, or low back.
You want other way?
Low back down.
Yeah.
Get rid of
So
the
what
air,
should
right?
we do?
So you're down to 50.
Yes. So you turn off the pump first,
Put
and
it
we'll
straight
change the
up in the
battery.
air so that gravity makes the lower density air go higher than the water.
Oh, I go through.
Yeah, turn off. One. No, you have to hold it.
Three. Yeah.
Change the battery.